electrodes. Well, these are fake electrodes. I can't actually use the ones that are here in the machine. They're very expensive, and once you use them, you have to throw them away. It's one-time use only. So basically, you want to get all your material ready. I'm going to turn the machine on. It's going to tell you what to do in a very loud and friendly voice. I have scissors to cut clothing. If you have to rip clothing, you have to do that. Sometimes you'll have someone with a hairy chest. So the AEDs may not have these in there, but I will put them in the machine. As of today, I have to go and do that. So you have to remove, make the blade ready, and you have to shave the chest where you have to place the lead. If someone has a pacemaker present, it looks like a clock, about a stopwatch size. It will protrude from the chest. Do not put the pad on top of the pacemaker. You have to put it right beside the pacemaker. Find the nipple line below the clavicle. You place the first pad, and then the second pad goes at the axillary point. Everything is well marked. If for some reason the pads don't stick, there's an extra pack right at the top here. So that has to be removed.
Call for help now. Remove all clothing from patient's chest.
Already done that. So basically, I'll be asking Annie, are you okay? She's not responding. She's not breathing.
Pull red handle to open
no
bag.
pulse. So I'll pull the red handle as she said. Once I pull that
Look
away,
at pictures on pads.
all the
Peel
pads,
one pad off blue plastic.
all the
Apply
pads have
pad to
colors.
bare skin,
My pad today is
exactly as
orange
shown in the
and white.
picture.
Here
Press
is yellow and
pad
red.
firmly. Peel other pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture. Press pad firmly. Remove all clothing from patient's chest.
Sometimes you have to cut or tear. So at this point, I have already checked to
Pull
see.
red handle to open bag.
She's going to keep repeating it until I do, what she said that do. And then once I have checked for her breathing, and she's not breathing, and I don't have a pulse, so I will initiate by giving 2 quick breaths. And you can use the face mask, which is with this, but you don't have to. If it's me on the floor, I don't care. Just help me breathe. Any of you, I believe, can save a life. And even if you never had formal training, just by listening to the prompter and doing what you know CPR is, you can go to youtube.com CPR. It's all there. If you have any questions, you can stop by my office. I can walk you through the process. 2 quick breaths until you see the chest rise and fall. After the 2 quick breaths, you find the nipple line. 2 finger breaths from the nipple line. And you start your compression. 5, 6, 7, 8, 9, 10, all the way to 30. You go back to breathe into the victim's mouth. She will tell you, do not touch victim. And you move back, analyzing rhythm. You're just waiting. It's reading that EKG thing. And she will tell you, administer shock. There's a button with a lightning bolt. You press the button. You do not touch the patient. She would tell you while she's analyzing the victim to not touch the patient. That's letter B. Press the button to shock. You will see the person jolt a little. It's not dramatic. It's just a little movement. And the process will continue until 911 comes. And that's what I should have said in the beginning. You find someone, merit, call 911. And you have to come back to let me know because I will need help, either with chest compression or with the breathing. It's a very exhausting process. You don't stop. You never take the pads off. If the person throws up, you take them from this position to the recovery position. It's like a pillow here, and the arm acts as a pillow. And their legs are up here, and the person will vomit, okay? You'll have gloves or whatever you need. And if you see vomit, this is when it's time to use that, you know. Actually, about 5 years ago, Steve Simmons and I had an emergency in which someone did vomit. And we kind of looked, and that's a recovery position, you know. I mean, you know what to do, and it will come to you, you know. It's amazing how the mind works. And basically, you keep going until you collapse or 911 comes. 2 breaths, 30 compressions. They're really quick, no 1 and 2, and they're not going to make it. 1.5 to 2 inches compression. Don't worry about if you do it too hard, just compress, 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 with a nice, steady rhythm the whole time. It helps to count, but the machine will tell you, stop CPR. Do not touch patient. It's perfect. Anyone can do it, and it will save lives. Over 1,000 people die every day because they don't have an AED in place, or people don't use it for whatever reason. So I would rather for you to try and save my life, because there's only one nurse on campus at a time, and start the procedure. You know, always call for help, but if the AED is right outside your classroom and someone is there in your classroom, don't wait for the nurse. Just get it started, and when I come in, you tell me where you are, and I will automatically fall into place with whatever we're doing here. Any questions?
I think it's important to note that the Good Samaritan